time to join. If you're not on mute, you might want to mute yourself. We're getting a little bit of background noise. I don't know if I can mute all right now, but so you can speak. Okay, and we're gonna do a little icebreaker. It's gonna be a real quick round robin icebreaker. But when I call out your name, let us know your favorite color. This is just gonna, you'll understand why I'm asking this later. Okay, Susan, I've got Susan on. What's your favorite color, Susan?
Blue.
Blue. Okay, and Net's on, Christy's on. Lori?
Pink.
Pink. Corey?
Red.
Okay. Alyssa?
Purple.
Purple. We haven't had a repeat yet. Dawn?
Blue.
Jen Bonna?
Blue.
Okay. Jamie?
I don't really have a favorite one, but I guess blue.
You'll go with the consensus, huh? Melissa?
I would normally say blue, but I don't have a lot of blue in my closet, so I'm going to say bright pink.
Pink, okay.
Mary Jane's with me too. She was at the Genetics Summit.
Great. What's Mary Jane's favorite color?
My favorite color is teal.
Teal. I gotcha. All right, Daphne. Daphne on?
Periwinkle blue.
Oh, I like it. Going for some variation there. All right, how about Amy Holly?
Coral.
Ooh. Adrian? Can you hear me?
Yeah, I'll do green.
Green, okay. That was good for yesterday. Mary Meeker.
Yellow.
Yellow, okay. And who did I miss? Who joined after I stopped writing? Anybody else that's on that I did not call your name?
Trish.
Hey, Trish.
I decided to drop in and listen in. And
Awesome.
my favorite color will be, I have two that I wear all the time, but they're not necessarily my favorite. My favorite is magenta.
Magenta, okay. All right, and mine is, I like periwinkle also, Daphne. That was the color of my wedding, so I'm gonna say periwinkle. And how about you, Annette?
Purple. Purple.
Okay, gotcha. All right, did anyone else join that I didn't get? I can't keep track. Oh, go ahead.
Me, Aurora's here, and my favorite is purple.
Who was that? I missed the name.
Stephanie, Aurora.
Oh, hey, Stephanie, how are you?
I'm good. Yourself?
Good, and you like purple?
That's correct.
All right, this will make sense in a second. You won't think I'm crazy. All right, I'm gonna share my screen. This is a Genetic Ambassador call for March. And we are going to do today, if this comes up here, can everybody see my slides that's on camera? This is Serving on Groups, continuation of our training. Oops, hang on just a second. I think I pulled up the wrong one. Let me see. There we go. Yep, this is it. Okay. We're going to do section 5 for Serving on Groups training. So this is a continuation of training that we started at our Genetics Summit back in October. And if you're just joining us and you haven't done the other modules and stuff, don't worry. You can jump in at any time. We have recorded the last couple Genetic Ambassador calls. So if you want to go back and catch up, those are under the For Families tab of the Mountain States website. And this specific section is tips and strategies for groups. And some of the things that we'll cover in this section, it's a shorter section, are what makes for effective meetings, what improves group dynamics, and what is two-way communication. So I'm going to go ahead and jump into these slides. I do want to let everybody know we do have a guidebook. It's called Serving on Groups That Make Decisions, a guide for families. And we have some extras of these guidebooks. So if you were not at our Genetic Summit and were not there when we started doing Module 1 and you would like one of these guidebooks, please let us know. You can either send myself or Annette an email And Annette has them where she is, her location, so she can mail one to you in the mail. And for those of you that have requested them, if you did not receive yours or something from the last time, let us know. But I know there were a couple people that requested guidebooks. So the guidebook is really helpful just to follow along and to catch up if you've missed a couple. And I just find myself referring back to it different times for advice and for tips, and it's a nice little bound guide. So if you want that, please reach out to us. So some of the tips for effective meetings are being prepared as a group, starting and ending on time. You'll notice I tried to do that today. We didn't want to go too far over the start time because we have a lot to cover today. Have the information needed to make decisions. This training specifically is for decision-making groups. And the difference between a group meeting where you're not going to make a decision and the group meeting where you are going to make a decision goes back to what the purpose of the group is and whether the group has the authority to make a change or a decision. So some of the things we talked about in previous modules are, some decision-making groups might be things at the school board level, or an advisory group might advise a decision-making group, or there might be other groups that are information gathering groups. So really trying to, if you are joining a group, really trying to understand the purpose of the group is really one of those first steps. Because if you really want to make an impact and you want some change to be made, you need to make sure that you are connected with a group that has the ability to make that change. And then another tip for an effective meeting is making sure you're not missing someone who is critical to the discussion. So that might be, somebody that has information that no one else on the group has. And then following a meeting agenda. So we're going to talk a little bit about group dynamics today and improving group dynamics on decision-making groups. So internal group strategies that can help with this would be having members get to know one another. And we do this in a variety of ways in Mountain States. This might be things like our genetic summit when we get together and we have some time at breakfast and lunch to network. Sometimes when we share experiences and opportunities. Today we used a really simple icebreaker, but the asking of the color, or I've done other ones where you ask your favorite food or something like that. Just something that's not the topic of the day, but just to get to know people a little bit better. Allowing time for cultural connections, and we're going to go a little bit deeper into this in this training. This also one great way to help the group dynamics is allowing for an orientation for new members. And we tried to do this for Mountain States prior to our genetic summit. We did a consumer orientation because we had a lot of people who came to Mountain States Summit this last time who were scholarship winners and who had never really didn't really know who Mountain States was, maybe just applied for the scholarship and that was their first experience with Mountain States. So having an orientation call was helpful to just get people oriented to the organization. And you can do this for your groups too. If a new member is coming into the group, pairing them off with somebody who's been in the group as a mentor can really help as well. You can also do refreshers for all current members and reorient current members as well. And again, I mentioned this mentorship idea, providing training and mentorship for new and current members. And then making sure to give the group's background information and history can be really helpful as well to improve group dynamics. So as I said, we're going to dig a little bit deeper into what culture means and the culture, different cultures and the term cultural norms we're going to discuss today. But when you think of culture, many of us might think of all different things. And I love this graphic here that shows me, that's you and me in the middle, you or me in the middle. And sometimes we think of culture as just the things that are in the gray shaded area, which I'll read off for those of you who are just on the phone. So we might instantly think of culture as ethnicity or gender or race or age, or sexual orientation, or physical abilities or qualities. But I love this graphic showing that there's a whole lot more that goes into that, beyond that, just that inner circle, if you will. So things like income, marital status, military experience, religious beliefs, geographic location, parental status, education, work background, all of these things weigh into culture as well. And really, culture is a way of life by a group of people. Very simply stated, but a way of life by a group of people. So there's a video here. I was not able to get it to play earlier, so I was having a little technical difficulties. So in the interest of time, what I'm gonna do, since it's a YouTube link, is I'm gonna post it in the Genetic Ambassador Facebook group so that everyone can watch it there. And if you're not in that Genetic Ambassador Facebook group, hang on, because at the end of this, after I'm done with this presentation, I'm gonna share information on how we can get you connected with that, or I can email it to you directly if you prefer. So this slide talks about cultural reciprocity and cultural humility, and the difference between that and cultural competence. So cultural competence can include things like mandates, laws, rules, policies, standards, practices, and attitudes. But when we think about cultural humility and cultural reciprocity, it's really a process and a lifelong commitment to self-evaluation. So it's not something that you just do one time and then forget about, where cultural competency might be more of a one and done. Cultural humility and reciprocity is an ongoing self-evaluation, and notice the word self there, talking about ourselves, not the other person, and critique of ourselves to improve relationships and outcomes. And the term you'll often hear about, or you often hear in these conversations, is something called cultural norms. And what does that really mean? So, excuse me, I wanted to read these two quotes, and these are out of the guidebook, because I thought they really kind of summed up the understanding what cultural norms means. Some families have cultural norms that make it difficult for them to discuss conflicting ideas or to question professionals' decisions. They may not become engaged, and meaning engaged in a group, until they receive a specific invitation with clear instructions about how to be involved. And that's from a study by Henderson in 2007. And then this one is from Alliance in 2006, and it says, some families may also come from cultures in which they need to preserve their need to preserve relationships is more highly valued than their individual rights. So you can see by that perspective how the group dynamics and serving on a group with someone whose culture is that they preserve their relationships with one another more than their individual rights might change how that person interacts with other group members. So a couple other things that are noted on this slide are recognizing and honoring racial and ethnic variation, providing trained interpreters so that everyone can understand each other in their native tongue, limiting the use of jargon. And I will say that Mountain States has been guilty of this a number of times, and always looking for our consumers to keep us honest in this. And a number of people brought this up at our last summit, is that the use of acronyms sometimes becomes so overwhelming that if you're a new person to a group, it really makes it difficult to understand what the terminology is. And so I lump acronyms and jargon in the same sentence, because I think especially in the medical world, that can happen a lot. So always looking to people like yourselves, like genetic ambassadors, and to remind us that not everybody knows what, CMA means, or WES, or not everyone knows what these terms mean. The encouragement of members to mentor one another can definitely help in this area, and the utilization of cultural liaisons and cultural brokers can also be of assistance. Understanding our own cultural norms, practices, and beliefs, and how they affect our interactions with others really can help us form a stronger group and form stronger relationships within that group. So I love this quote by Helen Keller, alone we can do so little, together we can do so much. And that's really the concept of a group in general, but especially a culturally diverse group. So this last part that we're going to talk about is two-way communication and some strategies to make sure the communication is going two ways. So make sure that the group is not just a one-sided conversation, but that there really are multiple sides of the conversation being shared. And I would encourage you, if you do have your guidebook, there are some other ideas in the guidebook on page 37, other than what's on here on this slide, but I'll go over some of them. Some external strategies to hear other voices can include town meetings. So if you've heard of like a town hall meeting, or in say like a municipality, or I know our legislators here in Pennsylvania have done that, where they've asked for people to join them at a town hall meeting to share what their concerns are. Things like public listening sessions of local, state, or national agencies. That's where the agency would come to a local area and listen to the individuals in that area. There's also, I talk about acronyms. Here's one for us. MCHB stands for Maternal Child Health Bureau block grants hearings, and so those are times where a specific agency, Maternal Child Health Bureau of HRSA, would take feedback. And then something called Breakfast with the Policymakers, and in the guidebook it uses Breakfast with the Principal as an example. So a time to get together with a specific person who might be an administrator, might be a policymaker, might be a decision maker, and sharing feedback and concerns and constructive criticism. And then things like policy forums, things like on health, education, disability. I was just sharing with Susan before the rest of you jumped on that I was at a disability summit last week here in my state, and they brought in legislators from state and national governments to listen to the disability community share their concerns about legislation. So that was a great two-way communication example. And then this last slide is really just the resources. I'm happy to post these again in the Facebook group as well, some of these links. But there's some things for techniques for improving meeting effectiveness, running effective groups, facilitating groups to drive change. And there is a great center, and Trish has taught me so much about this one, the National Center for Cultural Competence. And I know they have some, what's the name for it? Surveys that you can do for your own organization to kind of check your cultural competency level. So that's out of Georgetown.edu. And then there's another link on here for cultural reciprocity. So this was a short session. I went through that kind of quickly. I'm going to stop sharing for a second there. But I'm going to show you guys, now that I'm back on camera, I think you can see me, the guidebook. So if you don't have this, let us know so that you can get one of these. Because this has all the different tabs. Every different tab is a different module that we're going through for the Serving on Groups training. And this week was the tips one. So does anybody have any questions or comments, or how maybe this has impacted your own organization, or perhaps a group that you've served on, how that has impacted your serving on the group? Would anybody like to comment? If you might be on mute, if you're trying to talk, I'm not hearing anybody. If everybody's just being quiet. No one's gonna share. How about you, Trish? You're our I know you always have something to say. She on still?
I am.
Share with us some of your best resources, because I know you have lots of them.
Well,
I think my best resources are when I'm networking with the community groups themselves as to who or what group or reservation or diverse group I'm going to meet with. I try and put together other individuals who know the group, both maybe at the official level and one at the community level, because they both share a lot of great information, but it's different information. Sometimes I'll pull together a professional who's working with a special group or special group of population group and get their input, as well as, you know, 2 heads are always better than 1, or 4 heads or 5 heads to gather the information. And it's so important that you do pull from other people so that you're getting a holistic picture of the whole community. And I think there's other people on this call that I see that can talk to this as well.
Thank you, Trish. I appreciate that. Absolutely. 2, 3, 4 heads are much better than 1. So getting that perspective. Something else I was just pulling out here on the jargon and acronym stuff. Something that came out of the feedback we got from the Genetic Summit, and everybody saying that there was, you know, how do you handle all these acronyms, and how do you weave that? Our Colorado State team is putting together an acronym glossary that we'll be putting on our website, and pulling together, if you can't see it all, but look at this alphabet soup. There's a bazillion genetic acronyms out there. And so just making sure people have resources so that maybe if they hear something in the talk and they don't understand it, there's a place to direct them that they can learn more or look things up. And I know, Trish, you also have something, I was looking for that in my folder too, I have the wrong one out, but you guys have a cultural one sheet page from Family Voices. Where could we find that? It was something you gave to me, I think, at the summit, and had available copies there.
Right. It's on the website. You can do the search engine and put in like cultural competency or cultural, and it'll pull it up.
Okay, I'll look for that PDF and post that in the group as well, so people have that.
Okay. I have it, and I can probably, if you can't find it, I can email it to you.
Okay, perfect. All right, in the interest of time, I'm going to go ahead and switch over to my other PowerPoint presentation, which is, so for anyone who's new to the call, what we usually do is we do half training and then half Mountain States updates. And so I'm going to switch gears here and share my screen for the Mountain States updates part. Give me just a second, see if I can find it here. And we'll go into more details about what's new with Mountain States, and then let me see if I can get it. I think I have to stop sharing. Hang on just a second. And then we can go into some Q&A at the end here. All right, here we go. Genetic ambassadors. Give me just a second. I'm switching over here. And can you see that? Not yet. There we go. Let's try that. How about now? Anybody see that? Can I get a head nod? Okay, good deal. Uh-oh, we're getting some feedback. Let me see if I can mute. Maybe try muting your phone if you're not muted, because I'm getting some feedback there. Okay, so just a quick introduction for anyone who's new to the phone. I'm Christy. I'm the social media coordinator and consumer engagement director for Mountain States. And I'm also a parent and a family member of a child who the doctors suspect has a mitochondrial disease. I also wear another hat I have my own advocacy company. And just so we're all on the same page, part of our training was to establish the group and information about the group. So I always start with our mission for anyone who's new to Mountain States or just joining us for the first time. In this grant cycle, we are ensuring that individuals with genetic disorders and their families have access to quality care and appropriate genetic expertise and information. And these are through facilitating professional network of genetic clinics, key primary care practices, consumer advocates, that's all of you on this call, and state health department resources. And we just want to thank HRSA for the funding of this grant cycle, and their information is there in the bottom and below. So this is part of our Genetic Ambassador program, and anyone that is on this call is a genetic ambassador. There, you don't have to pay dues, you don't have to meet a criteria other than you are a consumer of genetic services, a parent or a family member or family leader in one of our 8 states. And Mountain States covers these 8 states: Arizona, Colorado, Montana, Nevada, New Mexico, Texas, Utah, and Wyoming. And so if you know other consumers that are interested in genetics, are impacted by genetics, and would like to be part of these calls, we have an open door policy. You can invite them. Just let me know, and so we can get them on our email list so they'll get the call-in information. So I have some new information that's going on at Mountain States that I want to just share with you. In January, late January, we started doing Facebook Live for a series called Your Genetic Questions Answered. So the first one aired, like I said, late in January, featuring one of our consumers, Heidi Wallace. And she talked about consumer advocacy. And our second one was scheduled for last Wednesday, but if anybody hasn't heard yet, Facebook was down for the good part of the day on Wednesday, and so we couldn't do our Facebook Live. So we have rescheduled that for this Wednesday, and I have some more details about that here in just a second. But so I want you to mark your calendars for this Wednesday to tune in, and it's going to feature Dr. Longo giving an overview about genetic testing. So it's one that I think you'll want to tune into, but you'll also want to share with support groups, friends, family on your Facebook page, because it's a really great overview of genetic testing that is available. And then the big news I want to share with you all is we are launching our genetics pop-ups. So if you've been on other calls, you've heard me talk about these, and you're probably saying, what is a genetics pop-up? So a genetics pop-up, we are terming as a small group of people, 5 to 8 people gathering, and it can be held in your local community. It's spearheaded by our genetic ambassadors. That's all of you, to share genetic resources with our community. The idea is if we start local, if we start small, we can make some ripple effects in our states and help other families and those who need this information. So some of the details include Mountain States has set aside some funding and can provide a $300 budget to cover some stipends and gift cards for the attendees, and the remainder of the budget can be used for food and drink, with the caveat, no alcoholic drinks, at the pop-up. Mountain States will also provide what we're calling Gene in a Box, which is a box of genetic resources for those in attendance to either look at, to take home with them. I've kind of scoured the country looking for free genetic resources and found some of those, so we've requested copies of those things. And then we have a lot of resources as well through Mountain States that we will include in there as well, including our developmental delay algorithm and some of the resources in that toolkit that can really help primary care providers as well. So we are asking you all as genetic ambassadors to step up, raise your hand, and see if you're interested in having one of these in your state. And the responsibilities, if you're probably saying, what would I have to do? What do I have to do? The responsibilities would be, you would help pick a date that works. You'd pick a location, anything from a local deli, a coffee shop, a restaurant. I know here in Pennsylvania, our Panera Breads have a back room that usually if you spend $50 or more, you can have that room to yourself. So anything like that. And then you would personally invite 5 to 8 families, community members, educators. You could invite a pediatrician if you wanted. It's not required. It's really looking at your local community and saying, who here needs to know about genetics? Who here doesn't know about genetics that I could start by just giving them some information? It might be a family struggling with a developmental delay. It might be when we were brainstorming this at the Genetic Summit, somebody said, well, what about a nursery school worker or a preschool worker? that sees a lot of kids that might have genetic stuff going on that, you know, their parents might not know yet that they need that assistance. Early childhood intervention worker. It's really up to you. There's no, we're not mandating you have to have this many people or that, you know, this type of person, this type of person. Really, this part is up to you. And really just thinking about who could benefit from genetic information, resources, and being connected to our region, and then specifically Mountain States resources as well. So we have a little bit of a timeline because our grant cycles start and end in the middle of the year. Our grant cycle, or our grant year, our second grant year, is ending in May 31st, and this money is allocated for this grant year. So we have just a second.
Clinics on top of their desk.
Hey Trish, can you mute your phone? Sorry. We have funds for one pop-up available per state. And so we have 8 pop-ups that can be had. And we're gonna hold that money per state through the end of the month. We're gonna have the application is gonna be coming out this week. We'll email it to everybody on this call. It'll be in the Genetics Ambassadors Facebook group, and it'll also be in our PD message that'll be coming out later this week. So we will hold the funding for 1 per state until the end of this month. If they haven't all been claimed by March 31st, then we'll open it up so that, you know, if we get 3 applications from Colorado and 2 from Texas, then we'll use that money so that we have all eight of them funded, and we'll allow multiples per state. But until the end of the month, we're going to hold it so that every state has a fair chance to have a pop-up in their state. And then because of the grant year cycle, we are asking that the pop-ups be completed before May 31st. And that's just because of reimbursement purposes. So if we turn in receipts from funding from the meal part of it, that be dated for May 31st. So how will this all work? We have a very short Survey Monkey form that you can fill out that, like I said, will be coming out, and it's about 4 or 5 questions. And you don't have to have everything in stone to be able to fill out this form. If you just say, hey, I really want to do this. This sounds like something I'd be interested in. Then you can fill out that form, and there's a checkbox that just says, yes, I will get a date on the calendar before May 31st. So even if you're thinking about doing it, if there's another advocate in your area or another genetic ambassador in your area and you guys would like to do it together, that's perfectly fine. And I've even had the request when we were brainstorming this again at the summit, you know, hey, I live in a rural area and I don't think I can get 5 people together. Could I do this virtually? That's an option as well. So we're open to whatever you think will work for your community within certain parameters that we have to meet for our grant funding. So if you have an idea, just reach out to me. Go ahead and fill out the form, and I can contact you, and we can talk about it, more details and specifics for your state. But I'm really excited about this. This is a way we can really impact our own communities with genetic information. And then I have some other exciting news, which is we have some scholarships available for some events coming up that are going to be offered through the National Genetics Education and Family Support Center. And this is a grant that is partnered with Genetic Alliance, Family Voices, and Parent to Parent. And they have some funding available for 2 scholarships. The first scholarship is for a building partnership skills workshop, and it's going to be held in Kansas City, Missouri on April 4th and 5th. It's coming up very quickly, but they are going to cover the travel expenses up to $1,500, and then also there's a stipend for attendance. The deadline for this is Wednesday, and I know that's very, very short notice, and I apologize for that. But if there is some people that are interested in applying for that, please contact me ASAP if you're interested. And I see Melissa shaking her head because I know she's already let me know. So if there's others interested, please let me know. And then we will work to help you with getting flights and accommodations made for that. There's a second scholarship where we have a little bit more time. coming up, and that one is also from the National Genetics Education and Family Support Center. And this number 2 scholarship is for the Family Voices Conference, the 2019 Family Voices Conference, which is going to be held in Washington, D.C. The dates of the actual conference are May 8th through 10th, but they are requesting that the scholarship winner come for a workshop the day before, which is Tuesday, May 7th. It's from 1 to 5. And so again, they will cover flight or cover a stipend that can be used for flight, hotel, and meal, which is $1,500. And then they will cover the registration fee for the conference. And then there's a $500 stipend to support your time and any other expenses that are incurred. We have a little bit more time, 2 more days to decide on this one. So that's at the end of the week. They would like to let us know that we are sending somebody for that one. So again, if you're interested in attending this, please let me know. I know Susan, who's on the call, and I went to the last Family Voices Conference. Susan went on a scholarship, and we got some great training. It's actually where I was trained, and Susan was trained on the Serving on Groups training that we're presenting now as part of this call. So it's a really great opportunity to meet other families from across the nation, other family leaders, other individuals involved with Family Voices. And I'm excited to say that I submitted a talk and will be one of the presenters for this year's conference. So I'm excited. So I will be going to this one in Washington. So both of those, if you are interested in either one or both, let me know as soon as possible. You can either, I'll give you my contact information at the end there, but email, Facebook, text, whatever works best, get a hold of me as soon as possible. And while we're talking about that, let me just let you guys know about what I've been referring to, which is the Genetic Ambassadors Facebook group. This came in really handy a couple of weeks ago when we had a scholarship opportunity pop up, and we literally had, again, just a couple days to find families for it. And then so I posted in the Genetic Ambassador group, and Adrienne saw it and was able to respond quickly. And so she just got back from the AmChip conference on a scholarship. So the Genetic Ambassador Facebook group is where we have a lot. I think we have about 18 or 20. So genetic ambassadors, that many of which are on this call, and it's a place to share information. And so if you would like to be added to that group, please email me, because I have to send you an invite from Facebook. And so I just need your email that you log into Facebook for, so because usually people have different emails than their work email connected to Facebook. So you just need to let me know the Facebook address where you're connected to Facebook, and I can then send you an invite to join the group. And if there's anybody that's wanted to be in the group and you've never gotten that invite or it didn't go through, let me know, because I've been troubleshooting with a couple people to get them in the group. Sometimes I have to friend you, and it's easier just to add you once we're friends because it pulls up right away. So if that's happened to anybody, just reach out to me, and I'm happy to troubleshoot that with you and get you in the group so you can see that information. All right. And then just as a social media coordinator, I can't fail to mention that we do have a Mountain States Facebook page. This is where our Facebook Lives happen. And then we also have a Facebook Twitter account, and the addresses are there. And we're going to talk a little bit more about the Facebook Live. I'm going to show you exactly how that works on this next slide. Here we go. So on the Mountain States Facebook page, I don't know if many of you are familiar with Facebook Live, but it's a live video stream that pops up right in your news feed. But if you're having trouble finding it on Wednesday, it's usually under this videos tab on the left. So that's a quick way to go right to it. But this is going to go live on Wednesday in the evening. It'll be going 9 p.m. Eastern Time, 8 p.m. Central Time, 7 p.m. Mountain Time, and 6 p.m. Pacific Time. Based on our data that we get from Facebook, that's when most people are on Facebook for our region. And so in the early evening hours. And so as I said, Dr. Longo is going to be answering specific questions and doing an overview of genetic testing. So you can tune into that. It's about, I think, 5 to 7 minutes long. And once it's over, if you're not available right when it's being broadcast, it's okay, because it's available on our Facebook page, and then you can view it later. So that's the nice thing about Facebook Live. You can either catch it live or you can see it later. And once it's there later, you can also share it. Like I said, you can share it to support groups. You can share it to your organization's page. But we're trying these out as ways to get snippets of genetic information to the general public, and in easily digestible format. So a way that people can learn quickly, easily, and on the go. So I just posted this graphic today. So if you would like to share that and have others tune in, you can do that as well by going to the Facebook page and sharing that graphic. And then, as always, we have a lot of information also on our website, which is mountainstatesgenetics.org. And I just wanted to point out, because I've just added this in the last 2 calls, under the For Families tab, I have a Genetic Ambassador tab. And that's where I'm putting the archives of past trainings and past calls and information about genetic ambassadors. So if you would like to look at past calls because you missed them or something, they're under that Genetics Ambassador tab. And then last but not least, there's my cell phone number to text or call if you're interested in the scholarship opportunities, my email address as well. You can message me through the Facebook page. I am here to serve you guys and help you guys continue to grow in your advocacy and your consumer influence in the genetics world. So I'm going to stop sharing my screen here. There we go. And we've got about 15 minutes, and so I want to open it up for discussion and questions and a chance to open the floor. So let me see. I think if you just unmute your mic, if you're muted and you'd like to share anything. Is there I'm going to start off throwing out a question. Is there anybody that's interested in doing a genetics pop-up? Does this excite anybody as much as it excites me?
I think it's very exciting.
Oh, good.
Yeah,
Don't all talk at once.
definitely interested in Nevada.
Go ahead.
Definitely interested in Nevada.
Oh, awesome. Okay.
Same here, Mary.
Oh, that was Amy. Amy
Yeah,
and
we
Mary.
should do that. We can do it together.
There you go.
We
Perfect.
did, but you come to me.
I was
I
gonna say,
can come to you.
you guys have to meet in the middle. You'll have to meet in the middle.
I don't know if there is a middle. Is there a middle?
I think it's Tonopah.
I would be so willing to. Or we'll just take turns.
Yeah, we'll talk about it.
Sounds good.
Awesome.
Any other states that would like to do it?
I think it's
Go ahead, Adrienne.
I'm interested here in Colorado. I just had a question as far as the kit goes, or the box
Peanut
that's being.
box
Yes.
of beans.
And so is it kind of giving you direction as far as what to cover, and what does that entail?
Yeah, so there's not going to be a script if that's what you're asking for. I really want it to be more of a conversation over food, or you don't feel like you have to do a presentation. There's not going to be a PowerPoint that you have to have AV equipment. We're trying to do this as low tech as possible, so hopefully that doesn't give anybody angst. But it's some of the things that we've gotten gathered up for the toolkit. Let me see if I can just grab them here. Sorry. So Genetic Alliance has a couple booklets, a guide to genetics and health and a guide to family health history. Some of these are in print, some of them aren't, so we're going to be printing copies of ones that aren't. So those are 2 things that'll be in there. We're going to be printing copies of our developmental delay algorithm, and then some of the family sheets that go along with that include like what is a gene? What are variants of unknown significance? And again, these are things that were made for pediatric practices, but they're things that families can benefit from as well directly, or they can help start a conversation with their pediatrician, perhaps kind of in reverse, about if their child has a developmental delay, they could share the developmental delay algorithm. So it's going to be resources and tools. And what I thought would be helpful for somebody who's not sure how it should look or whatever, I have like a outline of some things you can talk about. But once people decide they want to do a genetics pop-up, I can talk with people one-on-one on the phone, and we can go through some of that together so that it's kind of a little bit more one-on-one systems. Does that help, Adrian?
It does. Thank you.
Yeah, don't feel like you have to be like a genetic guru. You do not have to have, your genetic counseling degree. You don't have to be a certified geneticist. You're not presenting technical information. You're more sharing and finding out people's experience, what they know about genetics, and sharing resources that we know about, but then also just talking about your experience with genetics as well.
Adrian, this is Mary Jo. I'm also in Colorado. Would like to connect with you.
Oh, great. Okay.
Perfect. Are you
And
guys? You guys give me your permission? I can share your emails with one another.
That would help.
Okay. Perfect. I'm making a note.
And Adrian, did you say you were interested in doing one, or you just had the question? Because I had started to talk, and so I wasn't sure whether you were just asking the question or whether you wanted to do the pop-up.
No, I'm definitely interested in doing it. So if you want to combine, I'd love to do that.
Okay. Yeah, sounds good. And this is Jamie.
Oh, hi, Jamie.
Perfect. All right. Adrian and Jamie, are you guys already connected on email?
Yes, I believe so.
Yeah.
Okay. Great.
So if you can add me, Christine.
Yep, I've got you, Mary Jo. I will connect to all three of you. Perfect. All right. And then I saw Jen turn on her camera. Do you want to talk, Jen? No, she's shaking her head. Okay, sorry. I thought you wanted to talk. All right. Well, that's good. This is how the collaborations work, right? We're all on a phone together, and you realize we're all in this. You realize you're in the same place as somebody else that wants to do it. So that works well. So so some of the other things that we found that'll be in the box is I just found some curriculum for high school, junior high and high school curriculum on rare disease and genetics. So that is free from the NIH, and I was able to get a couple copies of that curriculum, so that'll be in the box as well. Again, not saying that you have to go and implement curriculum in your local school system, but just showing people that there's things out there that if they're interested, I mean, they can take it, and it's not stuff that you have to return to us. It's stuff that's yours to distribute. So perhaps there's a school teacher that you want to invite that, maybe has an interest in this. This is really trying to make ripple effects in our own communities, and bringing the conversation of genetics into our spheres of influence, if you will. And a lot of that.
I think that.
Go ahead.
I was just going to say, I think having that curriculum included is great. And I don't know if everybody knows, but each state nationally, actually every school district has to have what's called a SEAC committee, a Special Education Advisory Committee. And one of the things that Colorado is really big on is trying to talk about inclusion and community and compassion, and decreasing the rates of bullying and expulsion rates and everything. So I think that's great to have this included, so that we can, because I'm on my local committee, to present this to them and say, hey, here's another tool for you to use to help others understand that they're people too. They're just, and as a practitioner, kids that are more cognitively able, when they ask about my kids and they say, well, how come they're 10 and 12, but they're still doing stuff like this, or this is their toys, and I say, well, how you have a physical disability, they have a genetic disorder, and they have more cognitive. So I think having resources to be able to teach the younger kids, so we don't have the bullying, and I drive past when I see a client Columbine, and so I really like to help prevent future Columbines. So I know that's going really broad, but anyway.
Yeah, no, I think you're right, and I think about it too, like what if these curriculums that we have that I was able to find are for junior high and high school, but what's not to say that you share this with somebody and it gets implemented, and now you're training the next genetic counselor or geneticist to help our kids and our kids' kids. So that there's that ripple effect, and like you said, ripple effects with the special education committees, with school districts. I think there's so many ways that the ripple can go, that it just takes starting it, and hopefully this is a way that will be, you won't have to do a whole lot of work. So it's not meant to burden anyone. It's meant to be a way for you to share your story and your passion and your information about resources with genetics. So thank you guys all for. Would anybody else like to chat or share anything else that's going? Yeah, go ahead, Susan.
I have a question. I'm working more with an online community, and there aren't any geographic barriers there.
Right.
So what I was wondering is, like this lecture that Dr. Longo's going to do for 5 or 6 minutes, are these things that can be circulated wider, where it would cross into other regions, even other countries?
Absolutely. Good point, Susan. So just a little bit of background on the genetic Facebook Live project. If you guys remember, I know some of you do, I know Susan, you might, because I think you helped share this. We put out a survey around the time of the Genetic Summit last year, around October of last year. And it was just a survey monkey that said, what are your top genetic questions? What do you have questions about? And so we got back an amazing return of answers. We got 88 responses. And those responses came from all over the world. So we got a lot from because we asked for zip codes. We got a lot from our region, but we got some from Australia. We got some from Europe. And so this survey, just asking what people's genetics questions went global. And so our intention is not that these answers stay within our region. We're just using subject matter experts within our region to answer the questions. But the information is free and available to anyone who it gets shared with. So I think you shared the survey in one of your groups, and I know you have an. That's
probably why you got people from Australia.
I was going to say, I know you have an international following, so that might be some of those Australia responses. But this is not meant to say that this has to stay within Mountain States. This is something that we're using those in our region. I just recorded a couple more this morning with Dr. Elias, and we have some genetic counselors. If any of you in this group would like to do one, we all are subject matter experts in one way, shape, or form in genetics. So, like I said, we started off doing one with Heidi Wallace from Consumer Advocacy. So, if anyone's interested, please reach out. We have hundreds of questions that people ask. And there's probably no way to answer all of them. Some of them are very, very, very specific to a single family, and probably something that we won't answer because it's just too narrow of a topic that it won't benefit many people that watch it. It might only benefit that one family. So we're trying to take kind of the 50,000 foot level big questions and record those first, and the most common things that people asked. Does that help, Susan?
Yes, I think so. And I think the other thing that I run into all the time is that, all this polymorphism stuff that people are talking about, that's really what most people I run into think genetics is. I mean, that has been the definitions that they have run into. And so, are
you talking about like the single nucleotide polymorphism, SNPs?
Yes,
okay.
Yes, and ones that are common.
Right.
Like 40, 50 in the 45, 55 in the population or something like that. And so I think the public seriously needs some information about, well, Is that what you're talking about? Or is this different? Or how do I put these two things together? Because I think there's a sense in which we have two different communities growing and they don't know about each other, and they're getting the public really confused.
Gotcha. Yeah, no, that came up in a conversation I had with one of the geneticists, and while he wasn't ready to answer it right then and there, I think it's definitely something we can pose to one of them, is to explain that. The one that Dr. Longo is doing is going to give an overview of some of the technology platforms that are out there, and sharing a little bit of information about those, because I think that alone can be, you know, the term CMA gets thrown around a lot, but what is a chromosomal microarray? You know, that's some people have never heard that terminology before. So I think he's going to address some more of things general like that, but the SNP question is a really good one too. So thank you for sharing that. I'm going to note it down on my notes here. Great. Well, be looking for the link to the genetic pop-ups. And please apply. Like I said, even if you don't have a date in mind or a place in mind yet, if you're willing to do one, we can talk and brainstorm and help you get it going. But it doesn't have to be something big and elaborate and huge. You don't need to rent the grand ballroom at the hotel. Really, just something local. And start to be thinking about some people that you might like to reach out to. And I just want to make sure, I know a couple people joined at the end of the call here. Did I miss anybody that if you didn't tell me you were on? I saw Casey Singletary and Heather Schichtel were on. I see Alina. Is it Alina? I don't know your last name, Alina, I think. I'm going to mark it down here. And anyone else? Was there anyone else that joined that we didn't catch when we shared our favorite color as our icebreaker? I think the blues win. The blues and teals and variations of periwinkle.
Woohoo!
All right. Well, I'm going to let you guys go because it's right at the top of the hour. I just want to be cognizant of everybody's time. I thank you so much for joining us today, and for listening to the Serving on Groups training, and also for sharing some excitement with me with some of the things going on in Mountain States. Mark your calendar for Wednesday. Tune in. I would love to see some of you on there live. That will be great. And have a great rest of your week.
Right on. Thanks, Christy.
Thank you.
Bye,
Thank you.
Christy. Bye-bye.
Bye, everybody.
Bye,
Thank you.
Christy.
Bye.
Thank you.
Thank you. See you guys later. Bye-bye.